Welcome to Facts TV News, where everything is true. Bulk oxygen arrives in Jamaica. Health Minister Dr. Christopher Tufton this morning shared a video of trucks carrying medical oxygen at the state-owned oil refinery Petrojam. The minister said the delivery of the much-needed gas was a collaborative effort by the public health team, Jamaica Customs and IGL, the sole producer of medical oxygen in Jamaica. Healthcare workers have been struggling to decide which patients to administer oxygen to as the country faces a shortage due to the surge in COVID-19 cases. Keeping it clean. Catalina Thompson, a resident of Cassia Park in St. Andrew, makes use of yesterday's No Movement Day to clean up gravel and dirt on the road near her home left last week Wednesday by heavy rains. Payments for summer school were to start this week. The Ministry of Education, Youth and Information says teachers should, by September 2nd, start receiving payments for summer school work. Teachers have not yet been paid for duties performed during summer school, but it must be noted that we are still within the period committed for payment to be made, the ministry said in an email response to questions. According to the ministry, teachers were set to receive payments on August 31st, but the processing of claims were delayed due to several iterations of the documentation submitted. This resulted for the incomplete contracts, incorrect calculations, as well as the disruptions of work schedule and the unavailability of tutors to complete and sign to the changes, due to the challenges imposed by the novel coronavirus pandemic, the ministry said. The summer program, which was designed under the Education Ministry's Recovery Smart National School Learning and Intervention Plan, ran from July 5th to August 19, 2021. It was done to help students recover from learning loss due to the novel coronavirus pandemic. A number of teachers complained about the delay in payment. They said they were anticipating the payment last week, particularly because they have been facing financial challenges caused by the pandemic. The exact amount to the teachers was not immediately clear, but one teacher said the amount for each was less than $30,000. The ministry explained that the information regarding the processing payments was shared at the regional level, which might have been the reason why teachers have not received details concerning the matter. Notwithstanding, the regions have taken steps from the information concerning payment to be again shared with all tutors, reiterating our commitment to process all payments by the first week of September, it said. The ministry also said the processing of payments will be completed by the third week in September once all the required details have been submitted. However, the ministry pointed out that the no movement days this week will also affect the processing of the payments. Private hospitals, school nurses to be engaged in vaccination. Private hospitals across the island have expressed interest in administering COVID-19 vaccines at their facilities and will move one step closer today to realizing this goal when healthcare workers from these hospitals will be involved in a training seminar for vaccinators, a Ministry of Health and Wellness release stated last night. The release said the development comes following a meeting with Health Minister Dr. Christopher Tufton, senior officials from the ministry, and the leadership of the private hospitals. With our goals remaining to inoculate 65% of the population by March 2022, one method of achieving this goal is to expand the access to the COVID-19 vaccines, and engaging the private hospitals is one such way to ensure that all Jamaicans can be vaccinated against this deadly virus. This is also in keeping with what we have outlined in our National Vaccination Implementation Plan. The release quoted Dr. Tufton. According to the ministry, the vaccination training seminar is to ensure that the ministry standards are met and adhered to, and that healthcare workers are trained in cold chain logistics and management, health promotion and education, emergency services, management of vaccination sites, infection prevention and control protocols, and are introduced to the COVID-19 vaccines. More than 100 school nurses will also participate in the vaccination training seminar today. These nurses will now be considered qualified persons to do vaccination, who the ministry can utilize as it continues its vaccination drive in schools and communities across the island. Up to Saturday, August 29, A total of 512,327 doses of COVID-19 vaccines have been administered. Of this number, 370,081 are first doses, 139,579 second doses, and 2,667 single doses. To become vaccinated, members of the public are encouraged to make their appointments online at vaccination.moh.gov.jm or call the Vaccination Call Center at 888-663-5683. Nurse Sandra Lindsay urges Jamaicans to be stronger together in fighting COVID-19. Nurse Sandra Lindsay, who made history on December 14 in the United States by being the first person to take the COVID-19 vaccine in New York, is appealing to Jamaicans to join the fight against the virus by also taking the jab.
My fellow Jamaicans, it's great to be back home. While working on the front lines in what was to date the most challenging 18 months of my life and my career. I've always wanted to be a nurse. Never was I afraid of entering a hospital until when COVID hit, and every day I had to go in not knowing what to expect. I went in courageously, prayed, took my Jamaican remedy. I had to have a shot of turmeric tea with ginger, lemon, and garlic every day. And all I prayed for, to be alive and to be able to come back. So to be able to come back and to such warm welcome, I am humbled and grateful. So thank you very, very much. What I want to say to you, my fellow Jamaicans, Clarendonians, I know the hesitancy that's out there regarding the vaccines. It's been 8 months now since I got my first shot, and I've never felt more protected and safer. I feel safe enough to come here to Jamaica, back to my roots, and I've been enjoying some of the other things I love, which is being around people, and going out to a restaurant to eat, some of the little things. And that is what being protected can afford us. Nothing is 100% safe. So I just want to make that clear. But what you need to do is to speak to trusted experts who are experts in the field, infection control, virologists, people like Dr. Dawes, who I was introduced to here today, and our other colleagues in our medical sphere. Those are the people that you need to listen to get all the facts. Also read from trusted sites, not just from social media and people who just want to whether go viral with misinformation or just to stir up chaos and agita, etc. But they're trusted sites that I looked up myself and educated myself before I made the decision. So I'm appealing to you, COVID is not over. It's very much here. We need to be safe and protect ourselves. We don't live in a bubble, so we're not in silo. If I didn't think about the larger community, the world, including Jamaica, then I wouldn't be vaccinated and then be spreading the word. We are all interconnected due to globalization.
I was just introduced to Mrs. Sandra Lindsay, who was the first person to take the vaccine in the US. And of course, she's a Jamaican nurse, and she's from Clarendon. She's head of ICU in the US. And she's visiting Clarendon and encouraging us in Jamaica to take the vaccine. I would love to have her go to some of the hospitals and talk to our nurses and doctors and remind them about what she went through. It went very well. She is protected, no side effects, and we're glad to have her here. I would encourage everyone at this time to take the vaccine. So we are protected. We are going into our third wave. and the hospitals are getting full again. So we need to take the vaccine, and as it becomes available, we have to encourage and support each other to take it. There's different information out there, and I think people are afraid of, they're afraid of actually getting sick after the vaccine, and there are people who get ill after the vaccine, but it can be managed. People have also read in the media that you can get the virus after, which you can, but you should not be as sick or die from it. So it's worthwhile protecting yourself and protecting others around you with chronic diseases who are more apt to die. This new Delta variant, which we have not heard that is here yet, but maybe, are getting the younger people sick. So we should encourage them to take the vaccine.
Now we have an opportunity to be stronger together in our fight against COVID-19. It's high time we reclaim our lives and our livelihoods. COVID has stripped us of all of those for 18 months we're fighting this fight. So it's time for us to end this fight. And I know we can do that stronger together. The evidence is there. The evidence is there that the vaccines protect us against severe illness and death. And right now we are racing against these variants, which are replicating rapidly. So you see how we go Tokyo and mash up the race them? We can mash up the race right here against COVID.
Please remember to subscribe, like, share, and click the notification bell for daily updates.